It's not the operation, it's the operator. All right, think about these words, and I want to apply this to cosmetic facial surgery. I'm Dr. Joe Niamtu, lovethatface.com, and if you follow our channel, you know I do cosmetic facial surgery from here to here, and I don't do boobs, bellies, or butts. We have over 21 million views now, I think, on our YouTube channel, so I really enjoy corresponding with YouTubers. And I frequently get questions that that are in regard to how things are done, and social media has really put a helpful and a hurtful spin on the truth about cosmetic surgery and the procedures. So in some respects, it's been very good because it puts it out there and shows people what can be done, but it's so promotional that people promote these little mini procedures or this magic machine or cream or technique, and they claim that they're going to get facelift results or surgical results without surgery, and it can become very confusing. And I get a lot of people talking to me about, do you do a deep plane facelift? Well, the answer is yes, I do that, but they're asking in a way that if I didn't do it, they wouldn't come here or go to a specific doctor. And you know, sometimes patients come here and they tell me how they want their surgery done, and this is largely based on what they think is the right way to do it based on social media experience. And I explain to them that I've been doing cosmetic facial surgery, okay, for over 3 decades, and you can apply this to any surgeon that has a successful facelift practice, okay? They have crafted their technique over a long period of time to establish safe surgery with predictable outcomes, natural results, okay? And they do certain things, and you know, as you go up the line and become more experienced and more educated and have new technology, you alter techniques that you do. And good doctors are always trying to make things safer and better, easier, and for the patient to have a better recovery, more natural result, and longer lasting experience, okay? So just because you see somebody on the internet say, oh, never do this, only do this, always do this, you got to take it with a grain of salt. And I will tell you from personal experience, and I know I have cosmetic facial surgery friends all over the globe, and I know people in just almost every civilized country that does surgery. And if you talk to people that do a lot of facelift surgery, and you sat down with that patient and they could tell you about their experience over years or over decades and how they crafted the particular technique that they do now, it's quite interesting. And again, people that are really good, that are passionate about what they do, they're never, you know, I joke when I lecture to students and I tell them about the Greek god Mediocrities, okay? And it's like, you know, good is okay, because good is never okay. And really passionate people that care about what they do and try and make it better every day when they're in surgery and with their staff, they're just figuring out ways to do it better, do it safer. And so the bottom line here is it's not the operation, it's the operator. So if you find somebody that is well-trained, board certified in the area that they're working, they can show you hundreds or thousands of before and after pictures, they have an accredited facility, you can probably trust that they have gotten there by adhering to the situation. It's not the operation, it's the operator, okay? Because there are some doctors that'll just try something because the Kardashians say it, all right? And you certainly don't want that. So I hope this makes sense and answered your question. And I'll say it one more time. It's not the operation, it's the operator. And another way to say it, it's not the technique, it's the technician. I'm Dr. Joe Niamtu, lovethatface.com. I'm going to show you some of my before and after pictures. Thanks for watching. And now it's my honor to show you some clinical cases. And again, I have had the opportunity and the pleasure and the honor to treat over 1,100 patients with facelifts. So let's look at some of the results. And when you look at these pictures, I want you to look at the patient's jowl and the patient's neck and their cheek to a lesser extent. And I'll tell you, there's no better feeling than to take somebody with this type of aging and give them a natural, age appropriate result because that's what's important. You don't want a 78-year-old patient looking too tight. And again, getting rid of this extra neck skin and improving. And this is the before and after pictures of that same patient. On the left, it's before. The right picture is after. And you can see the way I do these incisions with the three arches just heal phenomenally. And I'm very proud of my ability to make incisions like this. Here's another patient, again, going from square to oval. And look at the jowl, look at the neck. The same patient in the lateral view. Look at the jowl, look at the neck. Same patient in the side view. And here are her before and after pictures. And if this is done correctly by an experienced surgery, the scars are usually imperceptible. Here's another patient with facelift only, and this is just a life-changing surgery for a patient with this type of profile. When we do liposuction and liposculpture and lipo-recontouring, we are actually permanently removing the fat in the face, so that fat will not come back, and we can really help sculpt these patients. This is the before and after pictures of that patient. Here's another patient with eyelid surgery and facelift. Look at the jowl, look at the neck. Here's the same patient, another view. And some of these people, when we get hollow and when we sag, we just become sad looking. And people say, Doc, my friends always ask me why I'm sad or why I'm tired. And you can see in the after picture we put cheek implants in this patient and facelift and lift everything up, give that oval appearing face and change their life. They look much more refreshed, youthful, alert, and awake. Male patients, very similar situation, improving the profile. Another patient with cheek implants and facelift. And this is just hereditary aging. This patient comes from a family where the females get this neck skin early in life. Another male patient, before and after facelift surgery. Another male patient, we did eyelid surgery, full face laser, and I believe cheek implants. So again, he started with wrinkles, but he didn't end with wrinkles. You look at his crow's feet and his cheeks because we did a simultaneous laser resurfacing. And here is that patient's before and after incisions. And I'm so proud to be able to do a surgery like this and have such great incisions and scars on almost every patient. Here's a patient that we treated. She saw another practitioner who told her that she had to lose 80 pounds or they would not operate on her. And actually, we performed upper and lower eyelid surgery, a chin implant, and facelift. And again, did a lot of liposuction and liposculpting, and great result and happy patient. Another male, look at the neck, look at the jowl. Another male patient, improving the profile. And if you look, you can still see his scar. That scar is probably about 8 weeks old and it should mature on its own. And if it doesn't, we'll go back and laser that and blend it in. This is a patient where we did brow lift, upper lids, lower lids, cheek implants, chin implant, full face laser, and facelift. So this is a very comprehensive case and what I consider a life-changing result. So I hope you've enjoyed this presentation, and I hope that my passion for face and neck lift surgery comes through in my discussion. And I also see so many people that really don't understand what a facelift does or doesn't do. And I think by watching this presentation, now you should have a pretty good idea exactly what does a facelift do and what does it not do. Again, my name is Dr. Joe Niamtu. My website is lovethatface.com, and you can see uh, similar presentations and many more things on my website. I have over 9,000 before and after pictures. I'm in Richmond, Virginia. Our office is 804 934 FACE, and I can be reached at niamtu@niamtu.com. I sincerely thank you for sharing your precious time with me and hope that you've benefited from this video.